Okay, we are talking all things health care insurance. We're talking about Medicare. We are talking about Medicaid. We are talking about ACA. We are talking about even your own benefits package that your employer maybe has that you might have a question about. So we are going to start taking your questions. I did want to answer that one question, Laura. What happens if someone is on Medicaid and they got that letter or something and then they chucked it because they didn't think it was anything they needed to read?
Well, if you just went to the doctor and then they said your Medicaid insurance has been turned off, then first thing you should do is contact your state Medicaid office and see if you can challenge the fact that you have been redetermined to not be eligible. And if that's accurate, if you are no longer eligible because you make too much money now, then you have 60 days to go and sign up. But if that time has already passed, then you might be stuck waiting until open enrollment starts November 1st and get on a plan next year. But first thing you should do if you have been kicked off of Medicaid is challenge it if there's any grounds to challenge it on if they got something wrong.
And that is calling the Medicaid office, yes? Okay, I just want to make sure that we give them kind of a step-by-step like process on that. All right, this is a question we get often. Catherine, this is you. How old do I have to get to be on Medicare, and when do I sign up? Let's give that timeline.
So, a very important timeline. 3 months before your 65th birthday, the month of your birthday, or 3 months after, you must enroll in Medicare. And you must enroll and choose to defer your Part B if you have an eligible plan that you are already paying for, and that would be an employer's plan, or you have to sign up for Part B. Part B is the part that pays for doctor's offices, pharmacies, all your outpatient stuff, and if you do not sign up for it during that period, you will pay a penalty for the rest of your life when you do decide to sign up for it. So take it very seriously, get online, get signed up. We've heard that getting a card is a little slow right now, so my best advice would be 3 months before your birthday, get online and go for it.
And if that happens to fall in line with the open enrollment for Medicare, great. But it has nothing to do with that if this is your first time signing up with Medicare. Again, it's that 3 months before, that 1 month, and 3 months afterwards. All right, so Steve, this person's asking, when do you enroll with Medicare and Medicaid? We just heard the Medicare. What about Medicaid? I think they're thinking that you can just enroll anytime.
Well, here's the deal. You can get Medicaid or you can be eligible to get help from Medicaid, whether you're under 65 or over 65. I mean, but both sets of people can qualify for Medicaid potentially there. So you always go through your Medicaid agency in the state to determine your eligibility factors there. And you can do that whether you're under 65, over 65, and you can do it at any time.
Okay, this question, Laura, is for you. What health insurance is available if you retire at age 63 before you can get Medicare?
Well, at the point at which you retired, the clock starts ticking for your special eligibility period that you are eligible to go to healthcare.gov and get an Affordable Care Act policy within a certain amount of time. So you can do that when you're 63, when you're 64, before you turn 65.
Okay. Catherine, this person says, does Medicare cover controlled substances?
It does if they are prescribed by a physician and you have a medical indication for it.
I'll be 65 in March. Do I need to sign up for Medicare insurance? I'm continuing to work past 65. Was told that I have to sign up, but I don't need it. So,
yes.
Okay. Steve, go ahead.
So yeah, you would sign up. Most people always take Part A. It's free. I mean, it's no reason not to have Part A. And then you would let Social Security know that you want to defer Part B because you're going to continue to get your group benefits. You have to be a little careful there because your group benefits has to be considered credible coverage by the government. Usually it will be if it's larger corporations that you work for. But if you work for an employer with 20 or less employees, you have to be really careful there because their coverage might not be credible, and you might be better off to go ahead and sign up for Medicare even though you are still working. So talk to folks about that. You can talk with insurance agents, you can talk with SHIP. You can go online and read up on that, but you need to be careful with that and just check it out really good.
Right, because
And
you
talk with your HR department at your employer.
right, like you don't need Medicare, right, if you're still working, but you need Medicare so you don't get that penalty for the rest of your life, to make sure that you sign up on time. All right.